Assalamu alaikum. I am Dr. Tohura Sharmin, Assistant Professor, Dept. of Community Medicine. Today I am going to talk on communication. So what is communication? Communication is a part of human's normal relationship with other people. Communication can also be called as a science and practice of transmitting information, a procedure by which one mind affects another. Actually, communication is sharing information between two or more people to reach a common understanding. So what is the definition of communication? Communication can be regarded as a two-way process of exchanging or sharing ideas, feelings and information from one place to another using a common medium. The role of communication in community health is to help motivate people to accept ideas, to bring about changes in behavior. Talking with anybody in any time, language, teacher, lecture, class, viva, written, exam, telephone, mobile, TV, internet. These are some examples of communications. Our ability to influence others depend on our communication skill like speaking, writing, listening, reading and reasoning. Now let's discuss the communication process. In communication process, actually there are 5 main components: sender, receiver, message, channel and feedback. Communication process, actually it is a cyclic process that starts with the sender and it also ends with the sender with receiving the feedback from the receiver. Now let's discuss first component of sender. Sender, actually it's called communicator, who is the originator of the message. To be an effective communicator, he must know his objectives very clearly, his audience, his channel, his message and his professional abilities and limitations. The second component of communication process is receiver. They are the consumer of the message. All communications must have an audience. This may be a single person or a group of people. Without the audience, communication is nothing more than a noise. So, audience, we can classify it into two types: the control group and the uncontrolled group. Control group, that means the homogeneous group, actually they are gathered together in a common interest, and the uncontrolled group, that means the free group, they are actually gathered together from a motives of curiosity. The third component is a message. This is the main subject of communication and it also called the heart of communication. A message is the information from which the communicator transmits to the audience to receive and accept and understand it. It may be in the form of words, picture or signs. So the characteristics of a good message: it should be in line with objectives, it should be meaningful, based on felt needs, cultural, clear and understand, it should be timely, adequate, specific, accurate, interesting and culturally and socially appropriate. And the fourth component of communication process is channel. Actually, it is a physical bridge between the audience and the receiver, between the sender and the receiver. And the last component of communication process is feedback. It is the flow of information from the audience to the sender. It is the reaction of the audience to the message by the sender. If the message is not clear or acceptable, it may be rejected by the audience. Now let's discuss the types of communication. The first type of communication is one-way communication. In one-way communication, the flow of communication is one way, from the communicator to the audience. In one-way communication, knowledge is imposed, learning is authoritative and there is no feedback like lecture class. And the two-way communication, in two-way communication, there is communication, both the communicator and the audience takes place, and the audience may raise question, add their valuable information, opinion, ideas, and these examples like demonstration class. And the verbal communication, it's actually traditional way of communication has been by word of mouth. Direct verbal communication by word of mouth may be loaded with hidden meanings. Face-to-face communication, given a speech, taking notes, taking voice notes, taking interviews, telephone conversation, these are some examples of verbal communication. And non-verbal communication, That means communication can occur even without words. It includes bodily movement, posture, gesture, facial expression like smile, raised eyebrow, staring, etc. Silence is also non-verbal communication, but it speaks louder than the other sounds or words. Now the formal and informal communication. Formal communication takes place, that means formal communication follows the lines of the authority, and informal communication takes place through gossip circle. And the visual communications are usually the charts, maps, TV, pictogram, table, maps, poster, etc., from which we get information or message. And the last one is telecommunication. Telecommunication is the process of communicating over distance using electromagnetic instrument like radio, TV, internet, etc. Now let's discuss the barrier of communication. Actually, there are many barriers of communication, but common barriers are physiological, psychological, environmental, and cultural. Physiological, it may be difficulties in hearing. In case of psychological, emotional disturbance, neurosis, level of intelligence, these are psychological barriers. And environmental barriers, in case of environmental barrier, for example, noise. If there is much noise in a communication process, a informative message may not be sent by the sender or may not be received by the receiver properly. The another barriers is cultural barrier like illiteracy, level of knowledge and understanding, custom, beliefs, religion, attitude, and most important, language variation. For example, in case of language variation, a person from Chittagong, if they talk in their regional language, or a person from Sylhet may not understand it, though both of them are talking or communicating in Bangla, but due to variation of language barrier, communication is hampered. Thank you.